Welcome back. It's been 5 years since 8 life Esidimeni patients were reported missing, and to this day, they have not been found. An inquest hearing into the tragedy is scheduled for later this month. Joining me now for an update on the search is the Gauteng Health Department's Head of Hospital Services, Dr. Freddy Kgongwana. Dr. Freddy, thanks for your time. We appreciate it. So what's taking so long? 5 years is a long time, right? Especially for the families who are wondering what's happened to their loved ones.
Good afternoon. We have been searching for the 8 individuals, and of these 8, we have 4 files that we received from Life Esidimeni, which helped very, very much. But the other 4, we don't have any records at all from Life Esidimeni, so there's still 8. And we have been making attempts with SASSA, with Home Affairs, and some of these individuals, their records cannot be found in terms of IDs. And the current update is we still don't have any connection as to where are these 4 individuals. The one that we don't have files from, as far as Life Esidimeni Life Health is concerned, it's proved to be more difficult for us. But we intend to continue with the search. We would like to have closure for the families. We would like to have closure for the community. We would like to have closure for ourselves, but not closure for the benefit of closure, but to learn out of this very tragic experience going forward, to be able to improve our systems and improve our way of managing patients' identity and so on. So we really not relaxed, and will never be, given the fact that 8 of our citizens who were associated with the Life Esidimeni tragedy are not yet found. And we will continue to do our best to search. We hope for miracles, we hope for redemption, we hope for something wonderful to happen, that we can identify where these 8 individuals are. More concern is that we were 4 that we really don't have records on, and that proves to be more difficult. But I don't think we'll have closure until such time we know where these 8 individuals are, these 8 patients are.
So let's talk then about the search a bit more, because you had these patients moving to smaller facilities from Life Esidimeni, right? Was there not a documentation done properly to say who's going where? Are you saying that process was flawed?
4 of the individuals that we have files from the Life Esidimeni hospital, we had visits to the addresses that were in those files. And to date, we haven't really been able to find anybody who confirms where these individuals are. The other 4, we don't have files, so as a result, we're not sure how to proceed, except to have communicated with, like I say, Home Affairs and with SASSA. Your question on whether was the process flawed or not, I don't think I'm competent at the moment to respond directly to that question, because one really need to go to do a deep dive. However, I think if one goes back to the previous, inquiries or commissions, there has been a lot that was found wanting in terms of that entire tragic, experience. At the moment, my concern as the head of hospital services is for us to continue to search for these patients, to search for the citizens who have gone missing out of this whole tragedy. So that's what we're committed to do at this moment.
Doctor, of course,
however difficult it is.
Yeah, 5 years later and you're still searching is a clear indication that the process was flawed, because you don't know where 8 human beings were moved to. That tells you it was flawed, right? So these 4 people, you knew that you were told that they were moved to certain facilities. You went to those facilities looking for them. What were you told? And have you investigated, or are you investigating, whether these people died at those facilities and there was a cover-up? Is that a possibility?
Yeah. Remember, when you're looking for somebody that you don't know where the whereabouts, you're not going to conclude and then take a very severe bias of whether it was flawed or not. The interest at the moment that we had as the Gauteng Department of Health is to do our best within the limitations and within what is available in terms of the public service, to continue to search for where these individuals are. Look, the entire process was on record in terms of the findings of Judge Mosenek. For us at the moment is to find closure. For the families, to find closure for ourselves, to find closure for the benefit of the community. We can never, take this lightly. It is an extremely painful experience. And the question that you are asking are very difficult questions, and the opening up the anxieties, the opening up the fears, the opening up the discomfort. But there's a job to do as the accountable people at this moment to continue to find where the whereabouts of these 8 individuals. The 4 that we have the files, the 4 we don't have the files. We cannot give up, no matter how difficult it is, no matter what aspersions are thrown, no matter what conclusions are made in terms of the process. What is key at the moment is for us to continue to search and search for these individuals.
Okay, so let me repeat.
It is in the interest of the dignity.
Let me repeat the second part of my question, which is for us to move forward. When you went to the 4 facilities, because you said you knew where 4 people were moved to, but when you went there, they were not there. When you went to those facilities, did you investigate whether these people actually died at those facilities and there was a cover-up or no record of their deaths?
Okay. I've made you aware that we received files of these individuals. And part of what we did was to go to their addresses, which is the homes of where these 4 individuals, who we have the files. The other 4, we're not sure where they come from, but they were part of the patients admitted as reported. What we are interested at the moment, because I can see your question is more interested in the different facilities. I don't have that information for you now. The information I have for you now is that we are not able to trace where they are, having visited the 4 who have their files, their homes, and telephone numbers we got no responses. The other 4, it's almost like a dead end because even IDs when we went to Home Affairs are not correct. But we'll continue to search for these individuals.
I'm struggling to understand why, if you go to facilities looking for people and you don't find them, that you have red flags raised in your mind and in your investigation looking for these missing people. Because that would be something of concern for the families and for anyone who's interested in what's happened to the 8 people.
Like I've said to you, and I'll repeat, that we will not find peace or comfort or closure as long as these 8 individuals are not found. And we intend to continue to search. And we're hoping that we will get to the bottom of closure of this process. It's not an easy one. And it will never be until such time we're able to find what has basically happened. We need to do more of a deep dive. It means going retrospectively, we'll have to do that. So where I am in the space that exists at the moment in the Gauteng Department of Health is to the team, which is the mental health unit team, to say, let us continue to do the best that we can to trace and find where these individuals are.
Yeah,
so that we can find closure.
Hope is clearly not enough, right? So would you consider, since that's 5 years later you can't find these people, would you consider perhaps going to police to investigate where these people could have been moved to? Because they are missing people within the Gauteng healthcare facility.
The police, according to the records that were given to me by the unit lead of mental health, is that the police were communicated with in around 2019. So we still have to go and find out, given the interruption of COVID-19 in terms of our activities and normal activities, we will have to visit our respectable, organizations, inclusive of the SAPS, inclusive again of the South African Social Services Agency, and any other agency that can make itself available to us, for us to be able to really continue and find closure to this very difficult question, which needs to be ultimately answered and responded to. So we will revisit our engagement with the South African Police Services, Missing Persons Bureau, and any other agency that would be made available to us or that will come forward for us to be able to identify where these 4 citizens of the country are.
And Dr.
We're not happy with what we did at the moment.
I know you say you're not happy with what's happened so far. So are you satisfied that you've done everything within your power and your means to search for these people over the past 5 years?
If you go to the South African Police Service missing persons list, there's about 1,000 people that have been missing. But one of the key issues when you look for missing people, you don't lose hope. And you said hope is not enough. Unfortunately for me, for us, hope is critical because we are in the business of hope. We are in the business of giving people hope. So we cannot forfeit our role as an organization that has to give hope to people that are not well, that are sick, to communities that are not well, not sick, that are seeking help. We can't give up. For us, there's a currency that we cannot give up. It's serious, the issue of hope. The issue that we have to be resilient to be able to find out. We have to be very persistent, and we have to sustain our search. We cannot afford, because life Esidimeni is a very painful chapter in the life of the Gauteng Department of Health and this country. We cannot take it lightly. It cannot be taken with simplicity. It's a very painful chapter. And finding respectable and dignified closure to this is very significant to us at this point in time. The difficult questions you're asking are appreciated because they enhance the desire that we all have, and all the stakeholders have, that we need to close this chapter, but not close it for the benefit of closing it, not maliciously close it, but close it with respect, with the dignity it deserves. I'm not going to lie to anybody. This is not easy. This is hard, but we have to do it. We will have to, even if it means repeating the same processes that we've done before, we will do that. If you look in the LID industry, there's a concept called redundancy. If you're going to be redundant about it, we will be redundant about it. Because the families, the community we serve, and ourselves, we need to have respectable, dignified closure to this very painful chapter in the history of healthcare in our country, in the Gauteng Department of Health. It will remain for the next 100 years a very painful chapter. It will never, never.
All right.
And we cannot afford to drop the ball. Cannot afford to drop the ball.
All right, thank you so much for your time. Dr. Freddy Kgongwana, the Gauteng Health Department's Head of Hospital Services.